Welcome to the Health Impact Hub's podcast, The Hub. This is a space where we highlight the voices of those shaping the future of health, not just in clinics and hospitals, but across communities, classrooms, and policy spaces. Each episode, we talk with leaders working at the intersection of medicine, public health, and policy to tackle some of the most pressing issues of our time, whether that's through advocacy, innovation, or grassroots action. I'm Sonia Dama, a second-year medical student at the University of California, Riverside. Welcome to The Hub. Today, I'm honored to be joined by Dr. Diana Ramos, California's Surgeon General and a lifelong advocate for health equity. Dr. Ramos is a board-certified OBGYN and the first Latina to serve as Surgeon General in California. She has dedicated her career to improving the health and well-being of all Californians, especially through her work on maternal health, mental health, and adverse childhood experiences. She's led at every level, from LA County's Department of Public Health to national leadership roles with organizations like the American Medical Association Foundation and the National Hispanic Medical Association. In addition to her clinical work with Kaiser Permanente, she's a respected voice in public health, policy, education, and cross-sector collaboration. Hello, Dr. Ramos. We're really excited to have you here today. We first wanted to start off by asking what initially inspired you to pursue medicine and what ultimately led you into public service and becoming California's Surgeon General.
Well, thank you so much for the opportunity to be here with you, Sonia. It's such a pleasure to be able to speak with you and to your listeners. So going to your question, what inspired me to pursue medicine? I've always wanted to be able to provide support and give back to my community. And medicine really was the easiest way that I saw. I think as a doctor, we are not only taking care of our patients, but we're also probably the most important resource for education when it comes to health, and the oftentimes overlooked opportunity that we have as physicians is that we are role models for not only our patients, but for others who see us as the physician. You also asked about public service. I went into public service officially and formally when I was the director for reproductive health for LA County. And that was after graduating with my MPH from UCLA. I got that 10 years after graduating from medical school. At the time when I went to medical school, people didn't do combined degrees. That really wasn't an option. You just did medical school and that was it. And I wanted to be able to have a bigger impact on society. And instead of being able to take care of one patient, I wanted to be able to take care of populations. And that's exactly what I did through public health.
I love that. And you've definitely become a role model both inside and outside the clinic. So it's great hearing both of those perspectives. So kind of touching on that role from Director of Reproductive Health in LA County, you've served across local, state, and national platforms, from director to leadership roles within ACOG and AMA. What kinds of impact were you able to make at those different levels, and how did that work differ?
Yeah, so the impact, a lot of it has to do with the voices of what we see in our communities. So I can tell you, being part of organized medicine, being part of national organizations, the beauty of that is that you get to hear what happens throughout the country. You get to hear not only what happens throughout the country, but even in California. So at ACOG, I was the chair for California, and I got to hear what was it like to practice in rural parts of California, like the Central Valley or the extreme northern part of the state, or in areas where there were under-resourced clinics, under-resourced hospitals, and to understand what made the care possible and listen to innovative opportunities to improve care. And just because the priorities in Los Angeles County where I lived were what I was seeing, you couldn't understand how, wow, okay, I see how when you're trying to get patients to come to your prenatal care in the rural part of the state, they really miss their appointments because you can't just say take an Uber or take a bus. There really is no transportation whatsoever. And it just helps open your eyes to the realities of how different people live, how different people practice. And I think that's the beauty about being part of organizations. I would encourage students, residents, professionals to really be part of your professional medical societies and give to the society as well. Because when you give through your active membership, your active participation, you're going to come away with a lot of information that you maybe didn't even think about. And it's your opportunity to elevate what is happening where you live, how you're practicing medicine with others who can maybe impact the changes. So, again, being part of those organizations really provides opportunities beyond just paying for membership.
Definitely. And I appreciate you really touching on the diversity within our state as well. I think that that's very important to remember regardless of where we end up practicing. I know you also mentioned transportation, which is one of our social determinants of health. It is very important to do the type of work across different sectors, and we know that you've been a leading voice on both maternal health and youth mental health. Can you share more about the type of cross-sector work you've been doing to address those issues?
Yeah, so mental health, and let's focus on the health part, not the mental disease. Mental health is critically important for everyone, whether you're a child, an adult, throughout the life course. It's foundational for really the mind body connection. And I don't know that we have emphasized enough. And so, as California Surgeon General, it really is a wonderful opportunity to be part of the work that has been invested on assuring that the mental health of youth stays focused and, more importantly, is reimagined as to how we're going to care for our youth here in California. So there has been pretty big investments, over $4 billion invested on improving the mental health of our youth. So 0 to 26 years old. And there are apps and there are programs, there are resources that have been available, peer to peer, really investments in community health workers to really be able to listen to the voices of what is important throughout California, throughout the diversity of our state, whether it's rural, whether you are an indigenous, LGBTQ plus youth, and just to elevate that and provide solutions for support and for care. And then the other big piece is in the reproductive age people. And when we're talking about pregnant people, as an OBGYN, I can tell you really the health of the mother is impacting the health of that unborn offspring. And so when there's chronic stress, when all of the cortisol levels are high for persistent levels, when you have trauma, whether it's intimate partner violence, whether it's mental depression, just depression in the mom, that impacts the mom's ability to care for the child. And that's one of the areas that, I'm trying to elevate as not only the California Surgeon General, but as an OBGYN who saw it for many years throughout my career, that really when the mom is healthy, the baby is healthy. Because when there's more of you to be able to give, whether that is paying attention, being able to breastfeed, being able to take care of you so that you can be there for the baby, it really makes a big impact. And data shows that there is improved learning, improved reaching of the milestones, as well as improved health in a child of a mom who is as healthy as it can possibly be mentally than when there's depression that's present. So if we can help support a new mom or a mom that's pregnant, we're really helping support a whole family and a whole community. So mental health is so critically important.
Definitely. I really appreciate that thoughtful answer. You have spent years serving Southern California communities as a physician. What are some of the biggest health challenges you've seen up close? I know some of which you've alluded to. And how have they translated into your priorities as Surgeon General?
So some of the biggest health challenges, I think, is just overall prevention, is having people understand the importance of prevention and trying to stay healthy as much as possible, as much as they can, in situations that maybe there is no access to care or there is no access to be able to buy the medicine or seek the care that people need. And I think that's something that we're slowly starting to change, and we're very fortunate that we are here in California, where telemedicine is something that is reimbursed equally to that of an in-person visit. And again, going back to the fact that if you have to work and you can't get away to get care during your work hours, or there are no appointments available when you are available, being able to have a telehealth visit is so critically important. And California has been very innovative in making sure that we try to get care to folks as much as possible. California has also been one of the few states, the early states, to implement alternative support, such as doulas, paying for promotoras, paying for more community health workers, setting up systems that will really improve the education, prevention, the advocacy for patients so that they can learn and they can better care for themselves, and subsequently it's an investment in their lifelong health. So I see that something that is changing slowly, and I oftentimes say that as California goes, so does the rest of the nation, and people throughout other states are learning how we are implementing some of these opportunities and improvements. And I'm hoping that the way that we are delivering care and expanding our health teams is going to be the norm in the future.
And kind of moving into our final question, Dr. Ramos, how can listeners who want to get involved with public health and prevention take their first step?
Great question, Sonia. And I would encourage everyone to look at opportunities in your local public health department. There are oftentimes committees that are available. There are also statewide committees that are available. There are appointments that you can apply for as well. So depending upon the level of interest and the level of availability, because oftentimes as healthcare providers, medical students, residents, you're doing a lot. And so remember what your immediate goal is. And for the medical students, I know you get passionate about wanting to do more, but really you need to pass your boards, graduate from medical school, and then you can, really give everything gung-ho after you're in residency. But encourage everyone to look at opportunities at your county level, state level, with your professional organizations. There are lots of leadership opportunities and involvement opportunities, and it could be the entrance to a lot more work in the future.
Amazing. Thank you so much for your time today.
Thank you. Such a great pleasure, and congratulations on the work that you're doing.
Thank you so much. I appreciate it. Thank you for joining us for this episode of The Hub. If you enjoyed this conversation, please subscribe and share it with others who care about the intersection of medicine, policy, and community health. You can find us on Spotify and YouTube. To learn more or get involved, follow us on social media at Health Impact Hub. Until next time, I'm Sonia Dama. Thanks for listening. Music by Drake Maestas.